Welcome back to Holistic Dental Healing with Dr. Aryani. Today we're going to talk about root canal prevention. Some of you maybe heard about the root canal, and a lot of you, when you heard about that word of root canal, that come in mind is that painful, hurt, expensive, and scary, right? So what is actually root canal treatment? In dentistry, if you have cavity and the cavity is get really deep down to the nerve chamber, got to the point that the nerve is being inflamed and infected because of the bacteria inside the cavity already get into the nerve chamber that's supposed to be sterile. So at that time, the body react to that by sending inflammation to the area. So then you can kind of feel this throbbing pain, and it wakes you up at night, sensitive to hot and cold. And then when you eat something hot and cold, it just doesn't stop. The pain doesn't just stop. It just lingers more than 1 hour. If that's the case, unfortunately, there are only two things to manage the pain. Number one, either doing the root canal treatment, or number two, to extract the tooth. Root canal itself is not without risks. When you remove inflamed blood vessels and nerve and lymph system inside your canal, what happens is you left with the tooth that voided of all of these important structures that keep the tooth alive. So basically the tooth is dead. In the main canal itself, it's already cleaned up properly, but there's many tiny tunnels on the side of the tooth itself that may not be able to be cleaned up. And then these little tunnels is dark, moist, and has remnants of very fine nerve and blood vessel and all that, and they become dead because the main nerve and blood vessel is already died. So all of this tiny little fine nerve and blood vessel inside is dying too. And since this is moist and dark, the bacteria can grow in there. And then this tooth not only is dead, but also there is the risk that all of this bacteria that collecting inside these tunnels can spew another infection, low-grade infection and inflammation, not only in the bone surrounding that, cause abscesses, but also can go around all around our body as well. These bacteria that go around our body through our blood systems is met with our inflammation system that try to ward off this invasion. So if this is happen day in and day out, these tooth that die and they become the source of the breeding ground for the bacteria, it's fight by all of our artery system, and it's become one of the root cause of atherosclerosis, or the hardening of the blood vessels. So instead of getting into root canal, today we're going to talk about how to prevent you, number one, from having pain, number two, to prevent any root canal treatment done, and number three, to maintain your healthy tooth structure with no intervention. Prevention comes by know what is cavity and what causes cavity, that destroying your tooth structure all the way down to the nerve chamber. So we have a lengthy video regarding that. So please check our video regarding what is cavities and how to prevent cavities to develop. Now, if you already have cavities but you come regularly for checkup and evaluation, if we see that the cavity already developed, even the smallest one, we want to take care of that cavity and remove it, and then put a new filling in safely to prevent the progression of the cavity. However, if the cavity is really deep down, that's really close to the nerve chamber, we still can save this tooth from root canal treatment by having something called a pop cap. In our practice, this pop cap is done using ozone and also laser before we put biocompatible material on top of that nerve chamber. So what is pop cap? Imagine if we clean all of this cavity out, and then the distance between the nerve chamber with the inner depth of the cavity is really close to the nerve chamber. Then after that, we're going to put filling and then see how it goes. In my practice, this type of treatment having a lot of great success. Only one out of maybe couple 20 or 30 teeth that having this type of treatment turned out to be that needing root canal afterward. But the rest, they become healthy and function well again. So prevention is always the best way to prevent any major issues. And then after that, early intervention. If that doesn't help, there's still one thing that we can do, which is root canal prevention therapy that I mentioned in this video, and hopefully that will prevent you to have any root canal. So thank you for your time. If you have any question, please don't hesitate to give us a call, 610-664-1641, or visit our website, presidentialdentalcare.com. So hopefully we can answer your questions. Talk to you soon. Bye-bye.